Welcome to everyone who's joined us today. Thank you for joining the Lucille Packard Foundation for Children's Health. I'm Cynthia Brandt, I'm CEO here, and I'm really excited to host this webinar series. We're calling it Deskside because it's a chance for everybody in our community to just metaphorically sit down desk-side with some of our fantastic faculty at Stanford Children's Health and Packard Hospital. We're trying to really bring you information that's timely about things that are on your mind as parents in particular. So our last session in Deskside was about vaping, and if you did not watch it, it was a great session with Dr. Bonnie Halpern-Felsher, and we'll send out a link after this session that includes the link to that video in case you want to still check that out. Today, we are focusing on what seems like just the most timely topic of supporting your kids' mental health during this really stressful time. And I want to say how impressed I am that you're all taking the time to really learn about and reflect on that today, given that we are in the most stressful of the most stressful times right after the beginning of the school year. So my heart goes out to all of you right now, and I'm so glad that you're joining us. We have with us our two experts today are the co-directors of the Stanford Parenting Center, which you may not have known we had a Stanford Parenting Center. But yes, we will be sending out a link to that afterwards too, all kinds of great resources. So for now, I want to introduce you to our great experts, Dr. Elizabeth Reichert, a child psychologist, and also Dr. Mari Kurahashi, who is a child psychiatrist. And these two are dedicating their lives to this very topic of children's mental health. And I thought I'd start by just giving the two of you a chance to help us kind of see into your worlds and your motivation and why you've made this your life's work.
Well, thank you, Cynthia, for that introduction. And it's really, I think it's just wonderful to be here together today. And, you know, to the point you just made, to really, I recognize, I guess, how hard it is to really add anything to our schedules these days, and can't thank everyone enough for being here, and really appreciate the effort that people are putting in. So I think really to answer this question of at least to start, I'll start, and then Mari will provide her answer. But you know, to answer this question of why child mental health and why I decided to pursue a career in this direction, I think was really influenced by many different factors. And as I reflect on it, some of the most impactful were really parts of my own life experiences. And as a freshman in college, my parents had decided to separate and then later divorced. And you know, my reaction to that news was pretty multi-layered, as you can probably imagine. And you know, I felt overwhelmed, I felt scared. I was also very respectful of their decision. But as the oldest in the family, with a younger brother who was significantly younger than I was, he was only in middle school at the time, I felt enormous concern for him, and I was fiercely protective. And I also felt a lot of guilt that I wasn't at home, and that he was really, at least from my perspective, I felt like he was having to bear both the emotional and the logistical burden of all that comes with such a family transition. And you know, we were both clearly experiencing this major family stressor, and I saw firsthand the impact our anxiety and stress responses can have. And yet, as we continue to navigate this way forward, I guess as a family, you know, it really started to become clear to me that my brother was coping quite well. He was doing okay, and that he was going to be okay. We all were as a family. And what this really showed me was that despite the potential consequences of early life stress, with the right supports in place, so much can be done to mitigate the longer term impact. And so, you know, it's not lost on me that this experience played a significant role in my desire to work with children, and really contributed to my interest in wanting to better understand the developmental impact of anxiety and stress. And this is, I guess, what I love most about working with kids is really the potential to change their trajectory, to make an impact on their development and overall functioning. And I feel immensely grateful to be in the position I'm in and to be able to be doing this work and helping to positively change children's lives.
This is why I love people who work with kids. Right there. Mari, how about you?
Thank you, Cynthia, for having us, and to the team that's helping us together, and to all the viewers joining us. And to answer your question, growing up, I really idealized my big brother, Peter. He was 3 years older than me, and he tolerated me tagging along with him everywhere. And when he went to college, I can obviously tag along with him there. And I had plans to visit him. But during his freshman year, there was a terrible accident, and he was killed. And we were certainly devastated, my parents and myself. And I think, reflecting on your question, I think the suffering and the shock that I experienced had a huge impact in my interest in pursuing this field. And I think what motivated me and continues to motivate me is to try to better understand how to help other children who suffer. And I think it's also perhaps a way to try to make there for some meaning out of an experience that really didn't make any sense. And so I'm just so grateful. And though to be a child psychiatrist, I find this field to be just so fascinating and certainly meaningful and very rewarding.
Thank you both for sharing this. And Mari, I did not know about your brother, and I just want to say how sorry I am on behalf of all of us, I think. And how moving it is that you've shared that with us and also made that a part of your life's work and your motivation. So thank you for that. I want to ask, both of you could be in private practice. You've chosen to work in academic medicine. Mari, do you want to tell us a little bit about the difference and why you've chosen to do this work?
Sure, thank you. So I work at Stanford. Being in full-time private practice would certainly be more lucrative of being at Stanford because I really appreciate the culture and the dedication that's focused on advancing science to really help people in very practical ways in their day-to-day lives. Being at Stanford allows for me to collaborate with like-minded scientists. It allows for many opportunities to contribute to the field by treating patients in innovative ways, research, teaching, program development on a much, much larger scale than I'd be able to do in private practice.
I love that part about scale and also about collaboration. And the fact that the two of you together are co-directors of the Stanford Parenting Center. So given your interest and your fierce commitment to kids and kids' mental health, help us understand why you focus on parents.
Yeah, it's a great question, Cynthia. And I think, before I dive into our answer around that, I think it's important just to note that for a lot of what we'll be talking about today, we're going to be using the term child, really for simplicity's sake, and but using that to really refer to kids across the developmental spectrum. So really focusing a lot of what we're talking about on kids in the elementary school age years, all the way up through the teenage years. So unless we specify otherwise, the child will be covering it all. So why focus on parents? It's a great question. So over the years, between the two of us of really treating hundreds of children, we have seen the critical role parents play in their child's well-being. And science actually shows us that just working with parents can be as helpful, if not more, than working only with a child. And so we really developed the Stanford Parenting Center to bring together scientifically based programs that work primarily with parents to address their children's mental health needs. so we have a whole range of different programs as a part of our center currently. And one of them is a parenting program called SPACE. And SPACE is a program that actually treats children with anxiety by only working with their parents. We actually really don't have much contact at all with the child during this program. And this treatment is shown by research to be as effective as individual cognitive behavioral therapy with the child. And so we find that those statistics pretty amazing, and we're seeing it work, which is a lot of fun at the same time. And another program that we have is parent-child interaction therapy, or PCIT. And that is a program that really coaches parents in specific ways to interact with their child. It is focused on addressing some more of the, I guess, the extreme behavioral challenges like aggression and oppositionality. And for PCIT, research not only shows us how much it works, but it also that the benefits are sustained for years to come. And then we have kind of a variety of other programs, including our parent training program and our mindful parenting programs that we'll talk a little bit more about later.
And another reason why we're also focusing on parents is that the current rates of childhood anxiety, depression, and suicides are skyrocketing, and it's absolutely terrifying. And this is coupled with the national severe shortage of child mental health clinicians. And so it's a really tragic situation. And so we're really focused on empowering parents and how to adopt effective parenting skills to try to prevent and intervene early in childhood psychiatric conditions. And now with COVID, parents are juggling even more while their children are even more at risk. And so we're especially energized to help empower parents in promoting resiliency in their children and protect them from the mental health risks of COVID.
Mm-hmm. It occurs to me that maybe sometimes parents are even more motivated than the kids to spend the time and the effort on these topics. If you're going to give us, Elizabeth, maybe I'll point this question to you, but a couple of key points for all the parents who are really so, I don't want to say desperate, but really eager for your guidance. What are a couple takeaways?
Well, I think, Cynthia, there are so many messages that we would want to give parents right now, and especially in face of all of this upheaval that we're experiencing due to the pandemic and now due to these devastating fires. I think one of the most essential things we can be focusing on really is doing what we can to be fostering resilience in our children. And it can be really hard to know how to do that right now. So I guess what I'd like to do is talk a little bit about this concept of balance and try to apply this to a parenting strategy that we actually know can increase resilience in our kids and can reduce risk for future mental health concerns. So balance is a term that I'm sure we have all heard before in the context of parenting. And for many of us, myself included, I think we're probably all on the seemingly never-ending quest to find this elusive balance between our roles as parents and the many other hats that we wear, and especially the new hats that we've been asked to wear given the pandemic. But balance is also a key component to many of the evidence-based parenting interventions that we mentioned earlier, and is really not only core to effective treatment, but also considered an essential component of prevention. Okay, so let's think for a moment about instincts and especially our parenting instincts. So our parental instincts are to protect and nurture our children, and they are so incredibly powerful and really truly critical for the survival of our babies. And as our kids develop, these same parental instincts continue to play these very powerful roles in how we parent. And sometimes, especially in moments when our children are struggling, these instincts can really lead us to respond in kind of one of two different extremes. And so on the one hand, we have kind of our more or less our overprotection mode, or another word that we like to use is accommodation mode. And then on the other end of the extreme, we have our demanding mode. And so when we're in accommodation mode, and we've all been there, every parent has, we feel the need to reassure our child and to really act in a way to alleviate their distress. So this might be like something like writing a note to the teacher when our child is nervous to take a test, or when they're nervous to speak to the teacher directly, or giving up a date night with our spouse because our child is refusing to stay home with a babysitter. Our accommodating actions really stem from our empathy towards our child's distress in that moment. And our intentions are good. We are wanting to protect, right? It comes from that instinct. And yet by acting this way, we're inadvertently insulating our kids from experiencing distress and discomfort that's really essential in promoting their own self-sufficiency. And so we have our accommodating mode, and then on the other end, we have our demanding mode. And so our demanding mode is when we are actively trying to get our child to act or feel differently in a moment. And so this might be like, for instance, when our child calls out to us at night because he's scared, right? Or because he isn't ready to go to sleep. And we might start with a calm approach, gently reassuring him, telling him, "Don't worry, honey, it's okay. There's nothing to be scared of. You're going to be just fine." We've all been there. And because this often doesn't work to change our child's mind in the moment, by the 10th time that he's calling out for us, we are now escalating as parents. We're raising our voice. We are feeling and expressing frustration. And we might even be expressing some shame. We might be saying things like, "Oh, come on, you just have to go to bed. Stop calling for me. You are too old for this." And now we're in this kind of complete power struggle around bedtime. And so again, in these moments, our intentions are good. We are wanting to be supportive, and we are really wanting to get our child to feel differently, to stop feeling the distress that he's feeling, and to move forward. However, when we're trying to make someone feel differently than they do, this usually backfires and can actually make them even more defensive. And we're also really failing to acknowledge that our child is having a real difficulty in the moment, that he's struggling. And so as parents, we all experience this constant kind of push and pull of these two extreme modes. And what we know is that, I guess, if we try to combine these extremes into a more balanced, supportive approach, children actually respond better. So you're probably wondering, what does this look like? What is this magical approach that you're talking about? So we want to, by taking a more balanced approach, we really want to be validating our children. So acknowledging our child's experience, acknowledging their feelings in the moment in a really supportive manner. And we want to be instilling confidence in their abilities. So we want to be acting in a way that reduces our tendency to really kind of jump in there and take over, and instead allows our child to be experiencing the distress and practice coping through it. And so in this way, we are actually promoting our child's development of healthy coping and helping to build independence and autonomy. So I want to try to give at least 2 examples here to try to make this make a little bit more sense. So let's say your daughter is anxious about or feeling nervous about attending school virtually tomorrow, and she is refusing to log on or to engage. In accommodation mode, we may be thinking to ourselves, "Oh my goodness, my daughter just can't handle this. This is too much for her. My job is to protect her. All this distress is, it's going to be causing her long-term damage. I've got to do something." And so we might say something like, "Okay, it's okay. You don't have to attend today. I'm going to email the teacher for you, and hopefully, I don't know, she can send a video or something, some work for you to do later, and it'll be fine." Okay, so that's in our accommodation mode. In the other mode, in our demanding mode, we might actually say something more like, "You have to attend. you have to go to school, but don't worry, it's going to be fine. You're going to be just fine. It's only on the computer. There's nothing to be scared of." which then may quickly escalate to her pushing back and us raising voices, tears, and us demanding for her to log on, right? So with either approach, our daughter is at risk of not going to school that day, right? Of not engaging. And in accommodation mode, we've kind of sent this implicit message that we don't think she can actually handle it. And in demanding mode, we've been pretty dismissive of her experience and maybe even increased shame around the fact that she's feeling this way. So if we took a more balanced approach, what this would look like is by saying something like, I understand that this is really difficult for you and that you're feeling scared right now. So there's our validation component. And I'm still going to log you on to your Zoom call tomorrow because I believe in your ability to manage this. So there's your instilling confidence in her abilities moment. Okay. So let's take a look at another example. And I'm going to talk a little bit about teenagers here, because for many of you, your teens are likely struggling with some lack of social contact. And I'm sure there's some discussions going on around that. So imagine now it's Friday night and your teenager is desperate to go out and see his friends. And up until now, he's really been hanging out with his friends via FaceTime and other social media platforms. He's been hanging in there. He's been following the family rules, but now he has hit his limit. He's had enough. And so now he's just threatening to leave the house, go down the street, attend this non-socially distanced party that is happening and that all of his friends are trying to get him to come to. And so in our accommodation mode as a parent, we might be thinking to ourselves, that's it, he's in so much distress. Teens are supposed to be social and I am taking this away from him. I'm being such a bad parent. This is going to cause long-term damage. And so we might cave and eventually say, okay, you can go, just go. I'll even drive you there. You have to wear your mask, even though you know he's not going to wear his mask. And then he goes. And in our demanding mode, we might say something like, absolutely not. You are not going to this party. We cannot risk the whole family getting sick. You know this. Don't you realize how hard this is for everyone? Stop being so selfish. You are going to survive without seeing your friends. And so in this example, we've either just compromised our family values and allowed our teen to go to the party and risk our health and safety. We've given in, or we have failed to acknowledge our teen's real difficulties in the moment and been pretty dismissive of how he was feeling. Okay, so what do we do instead? So a more balanced approach might look something like, I understand this is an incredibly difficult time and that not seeing your friends for so long can feel impossible. It feels this way for me sometimes too, right? So there's your validation component. And then we might say something like, well, I can't allow you to go to this party because of all the risks. I would really like us to get creative together and think about ways we might be able to arrange for you to see your friends in a safe way. I know you're going to be able to get through this. And there's that instilling confidence piece. So these more balanced supportive approaches are really letting our kids know that their discomfort is being heard, it's being understood by us as parents, and that we're instilling confidence in their abilities to be able to handle it. And we're giving them the opportunities to practice coping through it without solely relying on us, while also staying true to our values as a family. And so we're also, this really kind of helps us to set that stage for resiliency and autonomy, and reduces that risk of the future mental health concerns that are there. So I guess if you take anything away from what I just shared in these last few minutes, I guess the biggest thing I want you to remember is that we want to be balancing our validation and instilling confidence in our children's ability. So validating our children's experience and instilling confidence in their abilities.
Okay, that sounds fantastic. And I get the point, like, let's do that from the beginning instead of first trying accommodating and then doing the demanding dismissive, like better to start with the balanced approach. Right. But that requires a lot of parents. And is one more thing that we're saying, like, you know, you have to you have to do a lot of work to be able
Mm-hmm.
to do that from the beginning with your kids.
Yeah.
And Mari, I was hoping you could talk with us a little bit about how parents can do that and can practice it in the moment, and also being ready so that we can practice that.
Yes, thank you, Cynthia. That's such an important point. Because absolutely, on one hand, it's wonderful that the role of parenting is being recognized and studied. And at the same time, this can lead to more pressure on parents. And so Elizabeth and I absolutely want to support parents in adopting these balanced parenting practices to promote resiliency in their children. And at the same time, we certainly want to support parents in taking time for self-care so that they can have some personal balance as well. And it's so important, one, for parents' well-being overall, and then also, to Cynthia's point, it's critical to have the reserve and the bandwidth to show up as the parent that you want to be. And so one analogy that I find helpful is the oxygen face mask on the plane. When you're on the plane, the flight attendant always directs us to remember to put the oxygen mask on ourselves first in an emergency before helping anyone else, including our children. And this can feel like it's flying in the face of our parental instinct. And at the same time, it makes a lot of sense, because if we were to lose consciousness, we certainly couldn't help our children. And so it's helpful to keep this in mind, especially with parents who tend to take care of everyone else and neglect themselves. And also because for most of us, in times of high stress, self-care kind of goes out the window, even though high stress times are when it's most critical to take time for self-care. And these days, with everything going on, parents can kind of feel like they're a can of seltzer that's been shaken up on the verge of erupting. And at the same time, if you place that can down, with a little time, the bubbles and the pressure will settle. And you can open the can without an explosion and maybe even be able to enjoy a nice, refreshing drink. And the same can be, there's similarities to parenting. Because when we're so shaken as parents by the pandemic, distance learning, social injustice, the fires destroying the sacred, beautiful forests around us, leading to evacuation, we can often feel like we are really on the verge of erupting. And sometimes we need to stop and be still and let our minds and our bodies settle, and even to relax at times. And one way we can do this is by mindfulness practices, where we can cultivate a calm presence by becoming aware of what's happening as it's happening within a container of kindness and acceptance. Viktor Frankel is a Holocaust survivor who became a famous psychiatrist and wrote the powerful book, Man's Search for Meaning, that described how he survived his Holocaust and concentration camp experiences. And he describes there being a space between the stimulus and response. And in that space is our power to choose our response. And in that response is our growth and freedom. And mindfulness can be a way to tap into that space, because for most of us, when we're stressed, we kind of go in autopilot mode where we are either very reactive to the situation or we kind of shove it away and suppress it. And mindfulness allows us to be with whatever is happening as it's happening. So we can be with it and be with that space, so that we can have more choice in how we respond to the situation. And perhaps we can choose a more wise or effective response overall, and certainly when it comes to parenting, despite the enormous stress that a lot of us are having. So because mindfulness is very much experiential, I wanted to, if we could try a brief mindfulness practice. So we could begin by sitting comfortably in our seats, perhaps taking a deep breath in as we raise the crown of our head up to the sky, And as we breathe out, settling comfortably into our seats, and perhaps taking a few deep breaths in and out. And perhaps as we exhale, breathing out any stress from the day. And gradually allowing the natural rhythm of your breath to flow. And noticing the physical experience of the breath. Perhaps noticing your abdomen rising with your inhalation and your abdomen falling with the exhalation. The breath is our constant companion, and we can always turn to our breath to help us anchor us in the present moment. And by focusing on our breath, we're calming our nervous system. And we're cultivating a calm space and awareness so that you can bring your best self to your interactions with your child and your family. You might notice that the breath can be like a swing or a pendulum. And as you breathe in, the swing or pendulum swings up. And as you breathe out, it falls back down. And at the top of the breath, you might notice a slight pause. And again, at the bottom of the breath, when you breathe out, another slight pause. Perhaps noticing the stillness and quiet at the top and bottom of the breath. Perhaps being with that stillness. And as you perhaps tap into that stillness, taking the opportunity to ask yourselves, what does my child need? What do I need? What would be most effective? And then returning to the breath. So thank you so much for participating in that. At the Stanford Parenting Center, we have the Mindful Parenting program where we cultivate this connection to our calm internal space so that from there we can be more fully present for both the challenging and positive moments with our children. And each parent has innate parenting wisdom, and mindfulness and mindful parenting can help parents tap into that wise mind by listening with full attention, accepting themselves and their children without judgment, being emotionally aware of themselves and their child, self-regulating, and having compassion for themselves and their children. And research has shown that mindful parenting can be helpful for the parent's own emotion regulation, fostering positive parent-child interactions, and improving their child's emotion regulation. The mindfulness practices can be a way for parents to take care of themselves, even in small doses that are doable, and perhaps tap into steady, calm moments during the day, even during this global pandemic that we're in.
Mari, thank you so much. I'm sitting on a little stool without a back here, and at one point I did think like, whoa, I'm feeling very in touch with the moment. Will you tell us, and I do see that we're starting to get questions coming in, so I want to make sure we save a few minutes for questions. But could you just give us a little glimpse into the Stanford Parenting Center and what it is you're aspiring to do, and what it would take to reach that vision.
For sure. And just like you, yeah, I am feeling very relaxed after that mindfulness practice. So thank you, Mari. You know, we created the Stanford Parenting Center really with the goal of preventing the onset and really the progression of childhood mental health disorders, really by way of wanting to support parents and by offering really scientifically based programming. And so with this national, kind of a really well-known national shortage of qualified child providers at this point, and all of the challenges that families are having accessing high quality care, we really aim to broaden access to treatment and to services. And so we wanted to create a center where we could more or less level the playing field, you know, and provide easily accessible, high quality resources so that all parents and families would have a chance to thrive. And now, given that we're in the midst of this unprecedented pandemic, we see the Stanford Parenting Center as ideally positioned to be able to offer the support that families really need right now, and to be able to empower parents. And so we are most energized to be focusing our efforts on protecting youth from the mental health consequences of COVID-19. And so really, I guess with that in mind, we see support from the community as really helping us to further develop the main two pillars of the Parenting Center. So first, we see support as being helpful in program development so that we can continue to broaden access to care and broaden that access to care, especially through digital means. So I think it's important just to share, you know, an example. Early on in shelter in place, we created the Positive Parenting During COVID-19 webinar series that is now available on YouTube and also on our website. So it's accessible to the community. And since June, we have had a tremendous response with over 3,000 viewers and many requests for this series to continue. So this is just one thing out of many that we are very excited to try to continue to build on. And secondly, I guess we see community support as being helpful in really enhancing our research initiatives. So not only are all of our current programs based on scientifically supported practices, but we are also really hoping to expand our research efforts to focusing more on identifying the core parenting practices that are most effective in reducing risks for our kids. And so with support, we see the potential to make much faster, much larger, really, yeah, a much faster and much larger impact, both during this critical time and beyond the pandemic. So.
Thank you so much for that. As I said, we will refer everybody to the Stanford Parenting Center and the great online resources. Now, this doesn't totally keep with our mindfulness theme, because I'm going to suggest that we spend 7 minutes zipping through a number of questions, because it started to be a lot of questions and many people sent them in advance. So we're doing our best to answer them. So one is about how do you motivate a teenager to do online schoolwork, and how do you connect with them and de-escalate when they're maybe not as rational as you're making it sound?
Great. So that's a really timely question. Probably many of us can relate to. And so I think about Elizabeth's point of this balanced parenting, where bringing that similar frame of validation, acknowledging the difficulty of this school year, while also communicating confidence in the team's ability to do it, and also keeping in mind developmental aspects. So a teenager, we want to be supporting their autonomy, their movement towards autonomy, towards adulthood. So it's a little different from the elementary school age. So with the teenager, we also want to instill some idea of natural consequences. So it's not necessarily up to the parent to jump in and micromanage everything and be the helicopter parent that the accommodating mode will bring out in all of us at times. And so just to recognize that, but not be reactive to it, and allow perhaps the team to have some natural consequences if they're not participating. And for many teams, when parents step away and the team knows that the parent's not going to jump in, they may rise to the occasion and be able to manage. And that's the part, the confidence part is so important, that the parent's confidence in their ability to do so. At the same time, if that's not the case, if your team doesn't have that intrinsic motivation, it's important to first see whether or not that's there. And then if it's not, then perhaps to go to the next level, a natural consequence of, if the child or the team isn't showing us good judgment in being responsible, then they're also not able to then have kind of rewarding activities and whatnot. But I would first start with just seeing what the team does on their own.
Sticking with the focus on teenagers for a minute, because a lot of questions have come in from parents of teenagers. What about the loss and the stress of not getting to do things that we think of as part of the adolescent experience? So a number of people have talked about school dances and social events and athletics and things that their teenagers aren't getting to do this year. How do you help kids cope with that?
Yeah, I mean, it's such an important question and such a hard one to answer, to be quite honest. I mean, there is a lot of loss, right? And that we're all grieving in many different ways. And yet at the same time, I think while there is that loss, there is also an opportunity for us to be getting creative and be thinking about what are different ways that we can still be able to engage in some of these poignant moments in our teenagers' lives, and still have them engage in them, of course, and but just do it differently. And so I think it's again kind of coming back to this balance piece, right? It's this balance between kind of validating the loss, and the emotion that comes with that, and allowing our teens that space to grieve, and also trying to work with them to get creative, to come up with different ideas, and to think about that, of course, within your family values, right? And kind of what some of the things that your family's comfortable with, and I guess being mindful to really listen to your team's ideas, right? And not necessarily be dismissive right away, but be open to listening to the different ideas that they may have, to trying to kind of make the best out of this very challenging situation, and then working with them to come to a place that fits with your ideas as a parent and your family values, and kind of is that nice compromise between the two.
So several people have asked questions, some saying, I'm really glad that my child or my teenager has let me know that they're struggling, or they have questions, they feel isolated and anxiety. And some other folks have said, how do I know? What if my kids aren't talking to me? How do I unlock that kind of communication? So focusing on that latter, like, how do you help that as a parent? And especially several questions came in about kids who have just left for college, and how do you stay in touch and communicate and really understand what's going on for them so you can help them.
Yeah, it's such an important question as well, and I see it as being twofold. In terms of the children who are living at home, one way to help facilitate that communication is to really dedicate time, one-on-one time with parent and child, and recognizing that parents are so busy right now. It doesn't need to be hours. It could really be 5-10 minutes a day, but it's dedicated, where the parent's not on their phone, not answering emails, not cleaning, not just being with their child, and not asking about schoolwork or lecturing or talking about needing to clean up their room, but just being with their child, and just engaging with them and connecting with them in positive ways, often over time will facilitate more conversation and the child revealing more about their internal world. And similar to what Elizabeth said earlier, and then how we respond to what they say is critical, and the child continuing to communicate. So kind of the mindful listening, and when your child does say something, to just pause and fully listen without jumping in, without problem solving right away, but just giving the child space to speak and be very validating in your response first, and pause. And if you have some things you want to say, it's fine, but just to first really give that space. And then in terms of the child who's away at college, it's a really interesting time, because on one hand, children going away to college is such a pivotal developmental transition of launching, and in some ways it's important to have less communication. In some colleges, complain about the helicopter parents who don't let their children launch in college. And at the same time, recognizing that this is such a unique time with COVID, and so it makes sense to check in more. And at the same time, for parents, though, to keep in mind that teen plus now, and they are adults, and so to also be able to have confidence in their child's abilities while balancing checking in periodically as well.
It's super helpful. I'm going to just make the request, if we can just keep going for a couple more minutes. We have a couple more questions, and I understand some folks may have to drop off, but if we just go for maybe 4 or 5 more minutes. I want to ask, some of these seem really important. How do you decide how much to talk about with your kids about what's going on in the world right now? And then this is a separate question, but I'll just ask them at the same time. Another is, when is your child's stress and anxiety really concerning? What are some signs that you should be looking out for as a parent? So this is why I wanted to keep going. I think these are really, really important questions.
For sure. I think, so I'm going to try to be as brief as possible. So for the first question, in terms of, how much information should we be sharing? This is a great question that it really depends on the age of your child, right? So, for our teenagers can get a lot of information. We want to be honest and open with them. We want to facilitate conversations with them about what's going on, because quite frankly, if we're not doing that, then they're going to be getting that information elsewhere, right? So we want to be making sure that they're getting the information and the amount of information that we want them to be having, right? The accurate information. It also allows you to be able to be kind of keeping a pulse on their own stress levels and kind of what it is that they're thinking about and how it is that they're feeling about these things and what their friends are talking about and all of that. For younger kids, especially the real young ones, we can definitely shield them from a lot of this information, because developmentally they're not quite there in terms of being able to fully understand what's going on and to grasp the big picture around this. And so the most important thing that we want to be making sure that we're doing is reassuring them that they're safe, and that you and your family are there to keep them safe, and that, despite the many transitions everyone is going through, that everyone's safe. And so really kind of instilling that sense of safety. And for kids that kind of fall in the middle, it's going to depend on your child's own development and kind of how mature they are, and your own values as a parent. But recognizing that we want to keep some boundary there. And we do know, for instance, that kind of a lot of consumption of media. So the new, if the news is on for multiple hours a day, that is not healthy for any child or really any adult, especially, when we're going upwards of 2 hours a day. There's a lot of research to actually indicate that. And during these high stress times, right? And so, really wanting to kind of monitor how much information is being transmitted, just even around the home, right? If you've got the TV on or the radio on and things along those lines. So just being mindful of those different components. but so there's so much more I could say on that. But to just to turn to the other question in terms of, and I'm trying to remember now. So in terms of this piece of,
I just wanted the question about the signs, like what should we be watching out for that be really concerning in terms of anxiety or stress?
And I mean, I think this is one that you know, is a really necessary one to touch on, because I think, you know, stress is one of those interesting things that we all have and we all experience, and can actually be very helpful and important to us at times. And yet when too much of it is when things become a bit more detrimental, right? And so when we start to see signs of our kids really starting to withdraw more, or starting to be more irritable, or starting to have difficulties kind of maintaining their daily routines, losing interest in you know, things that maybe they enjoyed previously, and for real younger ones, you know, if we're starting to see some regressions in behavior, some more bedwetting, or, you know, for a child that's already potty trained and now resorting back to bedwetting, you know, those are all different examples of some regressive behaviors that are all potential signs of increased stress, right? And so it's hard to know, you know, there isn't this kind of perfect algorithm that tells us, you know, if your child is showing this, then they must be acutely stressed. And yet it's really about noticing kind of those changes from their baseline. And I think, you know, Mari and I both can agree on the fact that you as their parent, you are the expert on your child, right? You know, even though we have expertise in certain areas, you are truly the expert on your child. So you are going to be the one who's going to be able to notice that difference in their baseline. So kind of what their typical day-to-day functioning is, and when you see a real change from that. And that can, you know, that can definitely be an indication that stressors are getting higher. And Mari, I don't know if there's anything else you'd add to that.
Yeah, I think that that's such an important question, and I think it's linked to another common question we get a lot is, you know, will our children be okay? You know, this is such a big, stressful time, and I think it's very much related, in that it's important to recognize the signs for concern, and to also be preventative and intervening early, and therefore our kids will be okay. You know, as a humanity, we've dealt with many, you know, calamities and world wars, and we've persevered. And there's a lot of research to show resilience is actually can be increased through getting through hardship. And so I think things that could be really helpful, you know, before you see the signs, or if you see the signs, just reminders for kind of having structure for children, like in these times of constant change, having the steadiness of a daily structure, making sure your children are getting enough sleep, eating okay, getting, you know, enough, some physical activity. It doesn't have to be the same as pre-COVID, but paying attention to that. And there's a lot of concern about the socializing aspects, which is warranted, and at the same time complicated because of COVID. And so to keep in mind, a lot of research for resiliency shows the really protective impact of having an adult relationship. The presence of a caring adult in a child's life has been shown to be really protective during difficult times and fostering resilience. So also thinking creatively about certainly peers, but also thinking about the family and other adults in the child's life that you can maybe facilitate some social interactions with, whether it's through Zoom or playing, you know, online games together or whatnot. And then also having really kind of going back to family cultural traditions and kind of bringing a lot of that to daily life, and maybe having, you know, a daily dinner together. And, you know, the children are very responsive to kind of family traditions that could be, you know, like Friday is movie night, pizza night, like those kinds of simple things can have a really positive impact in the child's day-to-day experience, and again foster this resiliency that we're really wanting to focus on.
Resilience to be okay.
Yes.
I'm so glad you're bringing us to a close with that, Mari. Thank you, and thank you, Elizabeth, so much I want to say I find this really hopeful and really inspiring, and I'm so glad that we have the Stanford Parenting Center. I'm really thrilled to learn about it. We'll send more information out to everybody who's been on this call, this meeting. A couple people have said, are we sending the recording? Yes, we'll send that out. You can forward it to whoever else might find it helpful. And we'll also, there are all kinds of ways for all of us as part of the Packard community to support the work that Elizabeth and Mari are doing and their colleagues at the Stanford Parenting Center, both the research, evidence-based, like let's figure out how to do this better and better, and also the access and interventions and coaching that they talked about providing. So I hope a lot of people watching are getting benefit from this. I hope that you are going to raise your hands to help Elizabeth and Mari achieve their mission in life and professionally. And we're so grateful to have you here at Packard and Stanford Children's Health. Thank you so much. I want to invite everyone else. I have managed to lose the date of our next Deskside webinar. I'm sorry about the email after this, but it's about dealing with inequalities in health outcomes and how we can take that on 1 mile, one step at a time. So we'll send out that date. I hope everyone will join us and that you'll take really good care of yourselves and of course your kids as well in the meantime. So thank you very much for joining us. Have a good afternoon.
Thank you.